Right, Daniel, do you want to tell me about the patient that you're going to see next?
Yeah, sure thing, Adrian. Well, Mr. Tayu is a 55-year-old male who has been referred from ED with acute low back pain. Now, from his referral, the doctor states that it occurred 5 days ago at work while laying floor tiles. He was prescribed Mobic and Panadeine for pain relief and referred for a CT, but there are no results as of yet. This is all the information that we've received in the letter, so I will need to get the rest from my assessment.
Okay, great. And can you tell me a little bit more about Mobic and Panadeine?
Yeah,
what are those drugs used
sure thing. Well, Panadeine is an analgesic for pain relief. Mobic is an NSAID for inflammation.
Okay, great. So do you want to tell me what you're planning to do for your assessment and things?
Sure. Well, I'll start off the subjective examination by firstly asking the patient, kind of like what brought him in today. Then I'd go for I'd get my complete body chart, establish a current history, and research the mechanism of injury. Then probably get a past medical history check, check on any medications he's taking, and just get a bit of a social and functional history of the patient's goals and such. And once I've completed my subjective assessment, I'll come and discuss with you where to go from there.
Great. All right. Well, let's go see him.
Cool. Mr. Tayu, how are you?
Yeah, I'm okay, I guess.
Okay. My name's Daniel. I'm a physiotherapy student here. Just wondering, is it okay if I perform an assessment on you today?
Yeah, sure.
I do have my educator Adrian with me. All right, so we'll start at the beginning.
Yep.
What brings you in here today?
I hurt myself at work 5 days ago. I was tiling. Went to straighten up after doing a section. Just got a blinding pain just through my lower back. I couldn't even stand, so
right.
yeah, haven't been able to do anything since.
It's no good.
No.
No. Well, hopefully we can do something about that today.
Okay, great.
Just to start with, I'll just get you to show me where the pain originates, where you are hurting. I've just got a body chart here.
Yeah, just down here in the lower right-hand side, lower back.
Okay, so it's just hurting there.
Mm-hmm.
And does the pain radiate anywhere? Does it move down into your buttocks, into your upper thighs, into your back?
If I get the sharp pain,
Yep.
if I move wrong or do something, it just shoots down through the right-hand side of my butt.
Shoots down? Yep.
Yep.
Excellent, sure thing. Any pain around your knees?
No.
No, okay. And nothing further up? It's that lower back area and that's all?
Yeah, lower back, that's it.
Excellent. Okay, so now Mr. Tayu, we use a scale here, going from 0 to 10.
Okay.
0 being no pain and 10 being the worst pain you can imagine.
All right.
Just so I have a bit of an understanding, when it's kind of normal, like when at that base level, what kind of pain would that be?
5.
About a 5?
I guess, yeah.
Okay. And when you go through those movements, you were saying those sharp pains, what would you get up to then?
9.
9?
Yeah.
Okay, that's somewhat concerning.
Yeah.
Hopefully we can sort you out.
Okay.
Now you are looking a little uncomfortable. Are you in any pain at the moment?
Yeah, just been sitting for a while, so it's starting to really just niggle.
Okay. Would you be more comfortable lying down? We can move you into a more comfortable position.
Yeah, lying on my side's pretty good.
Lying on your side would be good. Okay, so Mr. Tayu, just to confirm, you have a 9 out of 10 for your pain at worst and a 5 out of 10 for the best?
Yeah, definitely.
Okay. And how would you describe that pain? Is it an ache or a sharp pain or a burning?
It's a dull ache.
A dull ache?
Through my lower back when it's sitting about 5.
Okay.
But if I move the wrong way or set it off, a cough or sneeze, that sharp pain, that's 9 to 10 straight away.
Okay. And would you describe it as deep or superficial? I know you mentioned that it was the sharp and the deep, but...
Yeah, the ache is,
yes.
definitely deep.
Okay.
To be honest with you, when it's a sharp pain, I couldn't tell you. It's just straight through me. Yeah.
Okay. And aside from the coughing and the sneezing, is there anything else that you can find that makes your pain worse?
Yeah, if I try to stand up straight too quick, or if I'm sitting for more than 10-15 minutes, I can get a flash of it as well.
Okay.
But yeah, definitely the cough and the sneeze, when everything contracts, that's just instant.
Okay, it's not good.
No.
No. Is there anything that you found that helps to reduce the pain?
If I'm lying like this,
Mm-hmm.
it can be pretty comfortable. The meds that they gave me as well takes the edge off it too.
Okay.
Yeah.
Now, from those movements that you mentioned that caused the pain before, how long does it usually take for that pain to set on?
If I get a sharp surge, good 10-15 minutes.
Okay.
To sort of reduce.
It,
yeah,
yep.
I've got to move around and shift a bit just to try and take the pressure off it.
Okay. But when you initially kind of make those movements, is the pain instantaneous? Yeah. Okay.
Yeah, absolutely.
Instantaneous. And takes about 10 to 15 to calm down?
Yeah, that's right.
Okay. And do you find your pain is better or worse in the morning?
It's worse in the morning.
Worse in the morning?
Yeah,
Okay.
When I first get up, it's really tight. If I have a shower and warm up, it tends to get a little bit better.
Okay.
And as I move around a bit more, it tends to ease a little bit more.
Okay. All right. So maybe because you're a bit stiff after lying down all night now.
Yeah.
And what about during the day?
I can cope with it during the day. It sort of generally stays the same as long as I don't make any of those sudden movements or set it off.
Okay.
Yep.
That's good. And what about at night, like when you're trying to go to sleep?
It's definitely worse.
Mm-hmm.
The medications help. That let me go to sleep. But if I'll shift during the night in my sleep, I'll get that sharp pain that just wakes me up instantly. Generally, if I can't get back to sleep, I'll have to walk around and really take the edge off it, and then try and ease myself back to bed.
Sounds inconvenient.
Yeah, I'm just not getting the sleep I need.
Okay, well, thanks for that. Now I'd just like to ask you some specific questions, just so I can rule out any sinister causes.
Okay.
Do you have any pins and needles or numbness anywhere?
No.
No. Any numbness in the groin, or genital area?
No.
No? What about any bladder or bowel changes?
No.
And have you had any unexpected weight loss recently?
No.
No? Any history of cancer?
No.
No. That's good.
Yeah.
Now, you mentioned you get pain when you cough and when you sneeze.
Yeah.
Describe this to me.
Basically, when the muscles contract, it just sets it off instantly. It just rips through me.
Okay.
Yeah.
Great. Thanks for answering those questions for me. Now, I'd just like to ask you a little bit about how you actually injured your back. You mentioned it was 5 days ago while you were laying some tiles.
Yeah, we're just doing a big job at the moment. I was doing one large section, so I had the apprentice running me tiles, so I was probably, head down, bent over for about 10 minutes solid.
10 minutes? Okay.
Finished off the section, I went to stand up, and as I went to straighten up, just got that pain just ripping down through my lower back and my hip, my thigh. Just shot through me. I couldn't straighten up. I ended up grabbing onto a bench just to keep myself on my feet.
Lucky it was there, eh?
Yeah, the apprentice came in, grabbed me, got me into the car. We had to lay the seat down because I couldn't straighten up. Got me off to the emergency department. They did a scan there, and pretty much they said to follow up with the GP, recommended me the physio, and then put me on the wait list for the specialist.
Okay, excellent.
And gave me some meds for the pain.
That's good.
Yeah.
Now, sorry, you just mentioned you had a scan in the ED. Do you have the results with you?
No, they said they'd send him through the GP and the specialist.
Okay, well, that's no problem. You don't worry about that. I'll get a hold of the GP and get those.
Okay, great.
Excellent. Now, over the past 5 days, would you say the pain has reduced, stayed the same, gotten worse?
I don't know if I'm getting used to it a little bit, or
Okay.
It seems to have reduced a little bit, or I'm managing it better, but it's still pretty consistent.
Still pretty painful, but kind of getting a bit better?
Yeah, I think so.
Okay, good. Now, do you have any history of back pain or any other episodes like this before?
Nothing like this. I mean, finish work and you saw it. It's what we do. We've been over all the time, but nothing where I can't go to work the next day.
Okay. Now, while it is safe to assume that in your line of work you would be getting some sort of back problems, have you noticed in the last couple of months or anything it getting worse or changing, and any differences in patterns? Are you working more? Anything that may have changed?
Yeah, we picked up a couple of big contracts in shopping centres last 6 months.
Okay.
So we're just doing bigger spaces, all in one hit.
Okay.
I get the ache when you finish work, and
yeah.
guess I didn't really think about it, but
it's always kind of been there, right?
Yeah, well, normally you finish work, have a beer, relax, whatever, it's fine the next day. But I guess the last 4 or 5 months, I'll wake up with a little bit of pain to start the day as well. But I just figured I was working a lot. So
yeah.
No,
that's fine.
Okay.
And sorry, just what about other medical history? Like any blood pressure, diabetes, cholesterol, anything like that?
Blood pressure's a bit high, but
blood pressure. Okay.
Yeah, I've been taking meds. GP's got me on them, and that manages it fine.
Sure thing. Any other surgeries? You haven't had any surgeries?
Not since I was a kid.
Not since you were a kid? And
yeah.
what was it?
I had my tonsils out when
Tonsils.
I was about 12, I think.
Yeah, you and everyone else, right?
Yeah, pretty much.
Cool. Now you mentioned you were taking some medication.
Yeah.
Which ones are they?
It's Trammel and Mobic.
Mobic, yep, that'd be for your back.
Yeah, that's right. And GP's got me on Cipramil.
Cipramil, yep.
Yeah, and Coversil.
Cipramil and Coversil.
Yeah.
Excellent. Now, you've mentioned you were a floor tiler.
Yeah.
How many years have you been doing that for?
Changed over and started on that about 10 years ago.
Changed over. Okay, changed over from what did you used to do before?
I was a builder. We did mostly roof trussing and framework.
Okay, so similar sort of work.
Still heavy
lifting, bending.
Yeah, framework and more timber work and there was just more in floor tiling, so I shifted over.
Right. Okay, makes sense. Cool. Well, thanks for that. Now, do you live at home alone or with a support network? Or?
No, I got the wife and the kids.
Wife and of course, right. Wife and kids. And how many kids?
2.
2. How old are they?
10 and 13.
10 and 13. Lucky. At least you don't have to carry them around anymore, right?
No, they're pretty much doing everything themselves.
Oh, that's good. Yeah. That's good. And do you have any stairs at home?
Yeah, there's a staircase up to the bedrooms.
One staircase?
Internal, yeah.
Yep, internal. And how many steps? Do you know?
13. Counting every one of them.
13, exactly 13. All right. Now, are you having any trouble negotiating those stairs?
I've been taking it easy and I just use the handrail up and down, so
good.
Yeah, I can cope with it.
Okay. Now, back before you hurt your back, sounds like a silly question, but did you need any walking aids or frames or anything like that?
No, fine.
No, you could walk fine? Perfect.
Yeah, physical job and get around the place fine.
Yeah, excellent. And how far could you walk?
As far as I need to, basically.
As far as you need to?
Yeah.
Okay. So no limitations?
No.
No limitations, okay. Interesting. Okay, so do you have any hobbies or any activities you'd like to get back to?
Mate, I've got 2 kids and work. That's pretty much about it.
That's fair enough. What about any sporting activities? Do you play any sport, football?
Not since I was a teenager, early 20s.
Not since you were a kid? Alright, what about the kids? They playing?
Young boys just starting now, so...
Just started?
Yeah.
Cool. What about the gym? Do you go to the gym or anything of an afternoon or in the morning?
No.
No?
Haven't had a chance to do that for years.
That's fair enough. Cool. Alright, well, I need to go talk to Adrian, my supervisor, so we can kind of talk about this and go through an assessment plan with you. Okay. Do you have any questions that you would like to ask me before I go?
How long am I looking, for back to normal, recovered?
At this point, that's a fair enough question to ask. At this point, we're not sure. I need to go talk to my supervisor. We can look at an assessment plan, and once we've gone through the assessment, we'll be able to have a more accurate kind of reading of how long the recovery period will take and all that.
All right, no worries.
It's a genuine concern, but look, we're going to do our very best.
Okay, great.
No
Thanks.
Okay, we'll see you very soon.
All right, thanks.
Thanks, Mr. Teo. We'll be back soon. Okay, Daniel, so tell me about some of your main findings from your subjective assessment.
Yeah, sure thing, Adrian. Well, Mr. Teo presented today with some low acute back pain. He sustained the injury at work. He's a floor tiler. He was in prolonged flexion, and when he stood up, he got a sharp pain in his right-hand side of his back, which has a little referral down into his right hip and lower buttock area when it's aggravated.
Okay, great. And so what are your main key points, asterisk points, important findings?
Well, his pain, when it is aggravated, is kind of sitting at around a 9 or a 10 it's got here. I also think that can be quite irritable for him as it comes on quickly and then takes a while to go away. So we should probably try and avoid doing anything too aggravating today. He gets pain with flexion as well as extension, coughing and sneezing, and it gets worse in the morning. Which kind of makes me think it might be an inflammatory issue, maybe a disc injury, and his pain medications are effective at reducing this pain. He didn't appear to have any red flags, only reported HTN in his medical history. He has gotten here that he did a CT, so I would like to check those results. As I said before, sustained at work, he's a floor tiler, and so previously independent and needs to have good function before he can get back to work.
Okay, yeah, really good summary. Just to confirm a couple of things, you mentioned red flags. There weren't any red flags, but did you think about yellow flags at all?
Yeah, look, I'm not 100% sure, but considering that the injury was sustained at work, there is a possibility of insurance claims, which could be a yellow flag.
Yep, yeah, definitely. Anything else that you can think of?
Not No, not really. It's the only one I could think of.
Okay, well, what medications is he on?
He's currently on Mobic, Tramal, Coversil, and Cipramil.
Yep. And do you know what those medications are for?
Well, Mobic and Tramal are for pain and inflammation. To be honest, the Coversil and Cipramil I'm not sure of, so I will have to go and check those.
That sounds good. Yeah. And while you're there, maybe you can check the CT results.
Yeah, good idea.
If they're back from ED.
Okay.
All right. Excellent.
All right. I'll
Let's
go
do
get
that.
those done.
Great.
Well, Adrian, we've got our CT scans back, and it shows that he has an L4-5 disc protrusion without thecal sac compression. MIMS has shown me that Mobic and Tramal are used for pain and inflammation. Coversil is for hypertension management, but Cipramil's for depression. That's a bit of a red flag, depression. Yellow flag. Should we talk to him about that? Is that something we should concern ourselves with?
Well, you're right. It is a little bit of a yellow flag,
Yeah.
but I don't think it will really affect the acute presentation and treatment today. But it's definitely something to keep in the back of our mind, and perhaps a referral to a psychologist down the track. But
Okay.
it's good that we're aware of it.
Yeah, it makes sense.
So, what are your thoughts on provisional or differential diagnosis?
Well, based on the CT results, I think it's highly likely to be disc pathology.
Okay, and any other factors from your assessment that might support this?
The pain from coughing and sneezing and the loss of extension.
Okay, and what other possibilities do you need to consider?
In terms of the differential, I'd probably thinking maybe facet joints or neural.
All right. So, what is it that you want to do in your objective assessment then?
Well, I'd like to look at him standing, assess his posture, and palpate for soft tissues to check for spasms. Look at his active range of movement to get him into sitting, assess rotation there. In supine, I'll do a neurological assessment to kind of do a sensation test and such. Then I would choose to do a PIVM assessment, left-hand side lying. This should be less provocative, which is kind of one of my concerns because the patient is a little irritable already.
All right, great. Well, it sounds like a plan. Let's go see him.
Cool. Hi, Mr. Tayu, how are you?
Yeah, fine.
Good. So I've just been liaising with Adrian, my supervisor. Just wondering if it's okay if we do a bit of an assessment on your back.
Sure.
That's fine? Excellent. So what I'm going to get you to do is I'm going to get you to stand up, take off your shirt. We're going to look at some specific muscle groups along your back. Before that, I'm going to lower the bed for you to make it a bit easier.
Okay, great.
Alright. Now, just before you stand up, just take into consideration you have been lying down for a while,
Okay.
so your muscles may be a bit tight. So just take it easy, sitting up, and if it starts to hurt, just let me know and I'll give you a hand.
No worries.
I'm just going to leave my notes down here.
Yep.
How's that feeling?
Yeah, a bit stiff, but
A bit stiff?
I'm alright.
That's alright.
Yep.
Okay. Now, Mr. Tayu, I'm just noticing some scars along your back. I asked you about surgery before. You mentioned you hadn't had any.
Yeah, no, they're I got some burns on my back when I was a kid. Just
Wow.
mucking around with fire, misspent youth. Yeah.
Oh, no comments on that one.
Okay.
Now I'm just noticing a bit of a tilt to your back. I'm just going to try and readjust that. Just let me know if that hurts.
Ah, yeah. Yeah.
Okay. So, all right. So it's around this area. I'm just going to do a bit of a palpating on your back. Is that fine?
Yeah, yeah.
Good. Okay.
Ah, yep. Ah, hey.
Okay.
And what level are you on there?
Sure. I was just palpating the erector spinae, just around the L3-5. Wasn't doing it too hard. It was very superficial. Mr. Taylor, what I'll get you to do is just under your belt. I just want to look at the muscles around there.
Sure. Just lie there.
Yes. No, that's fine.
Okay.
Okay. So, what about on the left side?
No, left's fine.
Left's fine, so it's just the right. I'm just going to go a little bit further above it.
Okay.
How's that there?
Yeah, that's fine up there. It's just
Just everything below?
Yeah.
Okay, now when that was happening, did it radiate any further down your leg or any other areas?
Yeah, just shot straight down through my butt there. Just.
Okay, and did it go further down your thigh or just kind of end at the bottom of your buttock?
Yeah, just at the bottom there.
Just that? Okay, sure thing.
Yep.
Okay. Alright, well, what I'm going to get you to do now is just a couple of movements, so I can test to see where your back is and what your ranges are.
Yep.
To start with, I'll just get you to put your hands on your thighs, moving forward.
Okay.
And then when that stops, so when that becomes uncomfortable, let me know.
Okay.
Come back, and then do the same thing backwards.
Okay.
Okay.
Yeah.
Okay,
That's
so
about
that's
it.
there?
Yeah, it's just a bit stiff there.
So all the stiffness is just what's stopping you, it's not pain?
No, it's just stiff.
Okay, that's fine. Coming back up. Okay, how's that feeling?
Yeah, it's just stiff.
Sure, no worries. So I'll just get you to come backwards now.
Okay.
No. Okay, now with that pain, I know we were talking about it being in the lower back. Is that extending down into the leg as well?
Yeah, that's just shooting straight through there.
And was it pain that stopped you, or pain and stiffness?
No, it's pain.
Just pain.
Yeah,
Okay.
just sharp pain, just shot straight through.
All right, not a problem, Mr. Teo. What we're going to do now, just coming back up to straight. Do the same thing, hands on your side, move to your left, and move to your right.
Okay.
Okay, how's that?
Yeah, just stiff there.
Just stiff?
Yep.
Okay. Coming back to center. And down the other side.
No.
Okay. No, that's all right.
Sorry.
No, that's fine. No need to apologise. Now, was that pain or stiffness?
Yeah, it's the same pain.
Same
just
pain?
Shoots straight through there.
Okay. And is that same area going down into your leg to the bottom of the buttocks?
Yep, that's the one.
Excellent. If I can get you to just sit down now, Mr. Teo.
Okay.
Okay, so we've done a few movements. How are you feeling?
Yeah, just a bit sore. It's just sort of dull ache now.
Yep.
Just from that, yeah.
Okay. We've just got 2 more movements to do.
Okay.
If I can get you to cross your arms in front of you on your chest.
Yep.
And just move to your left.
Okay.
And then to your right.
Yeah, that's about it that way.
That's about it. And what's stopping you? Just tension?
Yeah, just stiff.
Sure thing. Now back to the other side.
Okay. Yeah, that's it.
That's it. So is there any pain?
No, it's just stiff.
Just stiff? No worries.
Yeah.
Okay, come back to center. Okay, take a breath. We're all done with those for now. If I can get you now to move on to the bed, we're just going to do some neurological examinations.
Okay.
Excellent. Well, Mr. Taylor, we've completed the movement part of the assessment. I'd just like to move on to the neurological. Is that fine with you?
Yeah, sure.
Excellent. I'm just going to place my notes down here. I'd like to do what we call a sensation test, which will just be testing the sensation between your 2 legs, okay? So we'll give you a base value to start. So that's normal.
Sure.
Okay? So if that's normal, how does this feel?
Yeah, pretty much the same.
Pretty much the same?
Yeah.
Okay, so I'm going to move down the rest of your legs, right? So if this is normal, how's this?
Yeah, same.
Same? Good. Normal?
Same.
Same? Okay. Normal?
Yeah, same.
Same? Perfect. So that's normal.
Yep.
How's that?
Same.
Same? Normal?
Still the same.
Still the same?
Yep.
So normal?
Yeah, same.
Same? Normal?
Yeah,
How's that?
same.
Same. Okay, just going to move on to the feet. So top of the feet, that's normal. How's that?
Yeah, same.
Perfect. And with your toes, this is normal. Is that
Same.
normal?
Yeah, same.
Normal and
Yep, still same.
normal and
Yep, same.
yep. Excellent. Okay, now just going to go onto your feet. Sorry if this tickles.
Okay.
Yep. So if that's normal,
Yep.
and that.
No, it's still all the same.
Still all the same? Excellent. No problem. I'm just going to put my recordings down and we'll move on to the next part.
Okay, great.
Okay, Mr. Teo, so we've just completed your sensation assessment. How are you feeling after that?
Yeah, fine.
It's fine? Excellent. Now I'd just like to move on to a strength assessment. Is that fine?
Yeah, sure.
Yep, sure thing. Okay, so just starting with this leg, I'm just going to bend it up.
Okay.
Cool. Now I'd just like you to push back against my hand. Yep, that's fine. Just dropping that down there. Now we're going to move over to the other leg. I'm unsure if this is going to hurt, but we'll just take it easy.
Okay.
Stop it there.
Yeah,
Sure thing.
starting to twinge.
Okay. Now just try and push against my hand.
No.
Stop, that's fine. Okay, so we're just going to drop that leg back.
Okay.
How are you feeling?
Yeah, it's fine.
Good?
Yeah.
Okay. I'm just going to move back onto this leg. We're just going to do another assessment.
Yep.
Cool. Just lifting up, just going to put my knee under there.
Yep.
Now I'd just like you to push. Perfect.
Okay.
Excellent. Good, thank you, stop. Okay, now same deal. This may hurt. Just see how it goes.
Yep.
That's fine there?
Yeah, that's fine.
Excellent. Now just pushing up against my bottom there. Perfect. Okay, so you've still got strength over here. That's good.
Yeah, no, that was fine.
Okay. Now we're just going to move on to the feet.
Yep.
Okay. Now first of all, I'd just like you to push against my hands.
Yep.
Perfect. Cool. Alright, now try and pull back against them.
Yep.
How's that? Good?
Yeah, it's fine.
Cool. And now just pulling back with your toes.
Yeah, it's fine.
Excellent. Okay, let's let go of that.
Okay.
Okay, thank you very much for that. I'll just record my findings and we'll move on to the next assessment.
Okay, great.
Okay, so Mr. Tehu, we're just going to move on to your reflexes now.
Yep. Okay.
Just lift this leg up for me, thank you.
Sure.
Okay, so just testing this one. Perfect. Now, seeing as our sensation and our strength tests were normal, I'm just going to continue down and test the ankle reflex now.
Okay, yep.
Good. Thank you. Okay, so I'll just be a bit careful with this one.
Okay.
Is that fine?
Yeah, that's fine.
Thank you. Just write these down and we'll move forward.
Okay.
Alright, so Mr. Tehu, we've just done your sensation and your strength test. I'd just like to move on to a straight leg raise, just to kind of test your range there.
Okay.
Now what I'm going to get you to do is just you to stay relaxed, okay? I'm going to do all the lifting.
Alright.
So we'll start with this leg.
Yep.
So I'm just going to lift it as far as I can, and you just tell me the moment that I need to stop.
Okay. About there, it's starting to get a bit tight in the hamstring.
Yeah, the hamstring's tight there?
Yeah.
Yeah, that's fine. Just drop it down. Excellent. Okay. Now remember, relax. I've got this.
Okay.
Tell me the moment that it gets uncomfortable or starts to hurt.
Yep,
Okay, that's right. Yeah, we're dropping it. Okay. Alright, now where was that pain located? Same area?
Yeah, lower back.
And same extending into the lower area of the buttock?
Yeah, just shot straight down.
Okay. Well, the straight leg raise was positive at 30 degrees. The patient was in quite a bit of pain. I would have done my sensitizing movement just then, but I didn't think it was going to give me any more information than I already had.
Yep, that looks good.
Okay, so thanks for that, Mr. Tehu. What I'd like to do now is to continue on to some more passive movements, like that leg raise that I just did. Okay. So I'm going to get you to roll onto your side. Do you need help with that?
No, I should be fine.
Should be fine? Alright, I'm here if you need it, man.
Okay.
Good?
Yeah, we're good.
Perfect. Okay, I'll just get you to move just a little bit towards the end.
Yep.
Perfect. Okay, so as I'm raising the bed, I'm just going to explain to you what I'm going to be doing. Okay, so I'm going to be placing your knees out into my hips here, and that'll allow me to get a good kind of hold of them, right? So that I can move them forward and back, so that I can get a gauge of what's happening in your spine.
Okay.
Make sense?
Yep.
Oh, good. Okay, so, yeah.
Okay.
Got that?
Yep.
That's your L4. Okay, so now I'm just going to be moving like that.
Yep.
How's that feeling?
Yeah, that's fine.
That's good?
Yeah.
Excellent. No pain?
No.
Oh,
No, it's
perfect. Okay, so I'll just get you to tighten your knees up a bit.
Yep.
Okay, now I need you to move this hand
Okay.
up here.
Yep.
Alright. Cool, so now that we've got that, I'm just going to be doing some slow rotations of your lumbar spine.
Yep.
How's that feeling?
Yeah, it's taking a bit of the pressure off. Just relieving it a bit, I reckon.
Bit of relief?
Yeah.
Okay. This is giving the patient a little bit of relief, so I've decided I'm going to continue to do it for a while, just to give him a bit of relief before we go through our assessment.
Yeah, that looks much better. Keep going.